This comes as the FDA released briefing material that could begin to clear the way for Moderna and Johnson & Johnson's booster shots. Here to talk more about the vaccines is the White House vaccination coordinator, Dr. Bechara Choucair. So, Doctor, thanks for being here. We appreciate it. So what's the White House response to the governor of Texas?
Well, look, we know that vaccine requirements work. For the last several weeks, we've had hundreds of companies, healthcare organizations, universities adopt these vaccine requirements, and we're already seeing a lot more people getting vaccinated. Look at United Airlines, went up from 59% to 99%. Tyson Foods from less than 50% to 90% and over 90% once they put these vaccine requirements in place. We know vaccine requirements work. They get more and more people vaccinated, and they're good for the economy.
Does the White House understand the difference between people wanting to get the vaccine, wanting to be vaccinated, and the idea of a mandate? There's a very fine line there, but there is just a feeling of makes people shudder when they hear the word mandate. How would you address that?
Well, here's what I would tell you. We know that when you look at those folks who are still undecided about getting vaccinated, they're not a homogeneous group. For some of these folks, they still have legitimate questions about the vaccine, and we're encouraging them to talk to their doctors so that they can get the facts, and then hopefully they'll get vaccinated. For others, incentives would work. For others, they were waiting on the FDA to fully approve the vaccines. And what we know from these surveys, many people across this country are waiting for their employers to tell them to get vaccinated. So we know vaccine requirements is one tool in our toolbox. We know it's effective, and we want to continue to see how that plays out so we can get more and more people vaccinated in this country.
Do you and the White House support the idea of employers taking away someone's job if they refuse to get vaccinated?
Well, the president has been very clear in the 6-point plan that he released on September 9th. One pillar of that plan is to get more and more people vaccinated through vaccine requirements. And those vaccine requirements that the president has announced cover about 100 million workers in this country. That's about 2/3 of workers in this country, between folks who are working for businesses that have 100 employees or more, between the healthcare workers that covers about 17 million healthcare workers in this country, or federal employees or federal contractors. Again, we know these vaccine requirements work. We're seeing a lot more people getting vaccinated. And even those who are holding out all the way until the last minute, as that deadline gets closer, more and more people roll up their sleeves and get their shots.
All right, the federal mandate for public companies with more than 100 employees to mandate the vaccine or get weekly testing, when is that going to go into effect?
The Department of Labor is working on the rulemaking process. OSHA should be issuing that emergency temporary standards in the coming weeks.
Last question here, and it's a two-parter. So do you think boosters will be required every year like a flu shot is? And would you support the idea of an all-in-one vaccination of a COVID and flu shot, and some sort of a vaccine that would cover you for both?
Well, look, it's really hard to answer this question at this point. We have to wait till we get more data. Remember, this virus is new, and we have to wait until we get more data to see whether people will need more vaccines down the line or more booster shots down the line. What we know for now is we have 3 safe and very effective vaccines. They protect you from getting infected, but they're particularly good at protecting people from ending up in the hospital or dying from this virus. So it's really important for people to get vaccinated. For those who qualify for boosters, they should absolutely get that booster shot to optimize the protection that we're getting from the vaccine. On further boosters, we'll have to wait for the science and data, and that also applies for a joint vaccine, flu shot and a COVID shot. It's too early to predict at this point.
All right, Dr. Choucair from the White House vaccination team, thanks very much for your time answering these questions. We appreciate it.
Thank you so much for having me.
And if you still have questions about the vaccine, we've got you covered. You can text the word vaccine, 704-329-3600. North Carolina Lieutenant